both me and my husband have high-risk conditions, and my son does too. My son, he has a known form of dwarfism, so he is 16 years old, but only about 85 pounds. So he is smaller than a typical male. And my main concern for him was, would the vaccine dose be correct for him having such a small stature? And I went to the Little People of America website, and they actually had a statement on the vaccines, and they had thought that the vaccine was safe, to have a talk with your doctor, but they felt that the vaccine was generally safe.
Actually, I wanted to get the vaccine shots because I am a essential worker, because I work at a grocery store, and I decided to just be safe of getting the vaccine because I wanted to be my body. Don't want to get that crazy virus we had going on. I just want to protect myself.
There were a number of reasons that I chose to get the vaccine. First and foremost was to protect my own health, but also I have aging family members, grandparents that are both in their 80s and 90s. I found out that both my father and grandmother had cancer. So I know that they were both going to have treatment done. And if I wanted to be able to be around my family, I needed to, put my fears aside and get vaccinated so that I could spend what time I can with them.
Last year was just down in the dumps. It was boring. It was really depressing. And I realized that I wanted to have more of a life. I want to be able to see more the outside. I want to go places. I want to go shopping. I want to go out to eat. I want to go on vacation. So yeah, and they put it up. They told me, "Mel, come on," and I took it. I think I got one dose in January, and I got the other dose in February.
I think I decided to get the vaccine because at first it was like everybody was scared to, get out in the world without it. So, and I'm high risk anyway. So I was like, I can't go out until I get it.
The reason why I wanted to get the vaccine is because I'm working, since I work at a hotel and I'm around everybody.
It was a constant discussion here at our house. And here again, I'm wearing the hat as a parent. And I strongly felt that it was up to me to be the good role model. Personally, I mean, the first thought that comes to mind because of my age is basically to up the odds to save my life. And I think the older you are, when you do weigh out your odds, it was like, yes, vaccine is the way to go. And after reading and hearing and talking to both my personal doctor and another infection doctor, they both overwhelmingly said it should be done.
Thank you, and welcome to the COVID-19 Vaccines and Children with Disabilities, Ask the Expert. My name is Matt Norris from the Center for Health Equity at the Indiana Institute on Disability and Community here at the Indiana University, Bloomington. Joining you today, I hope wherever you are in the state of Indiana or from other states, you're enjoying this wonderful fall afternoon. I just wanted to let you know that we will have the availability of a American Sign Language interpreter today, and you can also access the closed captioning by clicking the live transcript by clicking the CC button at the bottom of your Zoom screen. We also have the availability of a stream text link that's available through the chat window. You can click on that if you would prefer to customize your captioning, you can do that by using the stream text version or stream text link. I'd also like to remind people that today we are recording this webinar, and we will have the archive available on our website. We'll have that information later in the webinar, how you can access that. And I know that a few people have contacted us, disappointed that they weren't able to make it, but just wanted to let folks know that we will have it available as an archive. We're very thankful that people submitted lots of questions for this webinar, and we already have a lot of questions. And so we can't guarantee that we'll get to all the questions, but I want to say that we do have that available. If you want to go ahead and put in a question in our Q&A, you can click on the Q&A, and we'll be monitoring that for questions that we can share with Dr. Ciccarelli at the end of her presentation. And we wanted to thank Dr. Mary Ciccarelli today for joining us. There are lots of interests. This webinar came at a very timely, and we also like to thank our panelists today who are joining us, Joanne Tedesco and Lisa Kuchera, who will be joining us today and sharing about their experiences being a family caregiver and kind of what went into the decision about getting the COVID-19 vaccine for the people that their children that they support. I'm sure that we'll have lots of links that we'll be sharing with you throughout the webinar, but one thing I wanted to note is that we'll put into our chat window here our resource list. This is a resource list that we've developed here at the Center for Health Equity that we would like to share with you, and feel free to note that link and come back to it. We're always adding new things, new resources that we're developing here at the Indiana Institute on Disability, and resources that we find would be very helpful and valuable to people as they go into making decisions about getting vaccinated or wanting more information about the COVID-19 and what's going on, the very latest information. At this time, I would like to introduce the director of the Center for Health Equity. I'd like to invite him to join us, and he is going to give us an update on our COVID-19 project here at the Institute.
Hello, everyone. I'm Ciccarelli, Director of the Center for Health Equity at Indiana Institute on Disability and Community. We have been hosting this Ask the Expert webinar series since this July to increase COVID-19 vaccination rates in the disability community. This is our third webinar. The difference this time is that people outside of Indiana also attend the webinar. As I shared at the last webinar in October, we have recently received a grant from the Centers for Disease Control and Prevention, CDC, through the Association of University Centers on Disabilities, AUCD. With this grant, we will serve as a regional hub to cover FEMA Region 5, which covers Minnesota, Wisconsin, Illinois, Indiana, Michigan, and Ohio, based on our primary focus on Indiana. If you are an Indiana resident, please note that we are recruiting disability advocates who will serve on our advisory committee and or serve as a trusted champion. We need guidance on our efforts from people with disabilities and caregivers. If you are willing to help boost the vaccination rates in disability community by sharing your vaccination experience and provide suggestions for how to effectively reach out to the disability community, please contact us. In addition, if you have a racial and ethnic minority background, specifically Black and Hispanic Latinx, or if you live in areas with low vaccination rates, you are encouraged to contact us. We will provide our contact information at the end of the webinar. Please feel free to contact us if you have any questions or need more information. Today, we will, as Matt mentioned, we will cover a timely topic about COVID-19 vaccine for children with disabilities. I know many of you already submitted your questions during the registration process. You may attend this webinar with your questions on mind. We are very happy to have two disability advocates sharing their experience today. Also, we have Dr. Mary Ciccarelli, founding director of the Center for Youth and Adults with Conditions of Childhood, and Indiana University Professor of Clinical Pediatrics. Dr. Ciccarelli will be available for your questions, even though we may not guarantee everything will be answered. We hope this webinar will help address your questions and concerns you may have regarding COVID-19 vaccine. Thank you. Matt, I will turn it over to you.
Thank you, Jay-Chul. And now I would like to introduce Peggy Holtz, who will be joining us today. She will be moderating our panelists, this panel of people who will be sharing their vaccination experiences. And I'll turn it over to Peggy to introduce the panel and ask them the questions.
Thank you, Matt. And I want to thank Joanne and Lisa for joining us today and sharing their vaccination experience, their experience and their children's experience. So to start off, I'd like to start with Joanne and just have her share a little bit about why she made the decision to have her daughter vaccinated and her whole family.
Sure, happy to share. Hello, everybody that's logged in today. I have a daughter with a rare gene disorder called DDX3X and autism. And so while there was a lot that I needed to kind of research on my own, try and figure out what the best is for her, she's still a mystery because of this rare gene disorder. So we don't really know if she is immune compromised, to be honest. But what I do know is I lost my sister on October 3rd. And so in conjunction with not wanting to lose another loved one in my family, I researched, I listened to the news, which is good and bad in my opinion, and can often confuse us parents that don't have a complete direction of what the disability is for our child, and how that relates to health. But to be honest, I wanted to have her back in the community. She had been homeschooled due to the loss of my sister and the fear that we had as a family. But we decided, after much research, going to the Foundation for a Rare Gene Disorder and having many conversations with moms and families that had vaccinated their kids her age of 12. And the final piece was my pediatrician going, Joanne, she needs this vaccination. And so for us and our family, the vaccination works for us because we don't have any immune compromised issues that we're aware of, at least, and to protect others in our family. My mom's in her late 70s, so that's what we chose for our family.
Thank you, Joanne. I'm just, sorry to hear about your sister.
Thank you.
Lisa, would you like to share how you made the decision with your son to get the vaccine?
Absolutely. Thank you so much for having us. My story really isn't all that different from Joanne's. My 19-year-old son has autism and an ear disorder, asthma, chronic lung. And it was a decision that we made because of the fact that so often COVID is affecting the lungs and the airways. So out of that type of fear, we were looking pretty closely. We too consulted our pediatrician, as well as the other medical specialists that we meet with. And we made the decision to get vaccinated, mostly for that protection. And it is out of fear. Ben no longer wanted to go to school. Even though he was eligible to return back to school, he didn't want to go. He had some fear of being in the school building and having the opportunity to get this disease, which we too had a pretty early on experience with someone passing away. It wasn't a family member, unlike Joanne, but it was an athletic director that worked very closely with our family. So we wanted to make sure that he was protected, and Ben had that fear, no matter how you look at it, whether that fear be justified or not. He had that fear, and he ultimately wanted to go back to school, and we knew from a social standpoint he needed to return to school. So the decision was made by all of the parties, medical and family, to get the vaccination.
Thank you. I wanted to ask you, Lisa. I mean, you obviously did your research, and you had discussions with Ben. So he gets the vaccine. So what are the benefits to Ben that you're seeing? Why it was important for him to get in, what he can do now that he wasn't able to do before?
He's actually doing a lot. Ben was working prior to the pandemic in a restaurant, and due to the pandemic, that restaurant closed and they were no longer using wait staff that he is. So once he got the vaccine, he wanted to look for a job. So now he's returned to school. He graduated during the pandemic, and now he's working, all with somewhat of the comfort that a vaccine is protecting him a little bit, that he's comfortable with being in the community. He's comfortable with returning back to friends groups and Special Olympics and things like that. So it just made him more comfortable and willing and able to participate in the community.
And you didn't mention that he also gave the commencement speech at his high school graduation.
I didn't, but he sure did. He sure did, which is an amazing accomplishment for a kiddo on the spectrum.
Thank you. And how about you, Joanne? What is your daughter able to do now that she wasn't able to do before? And how has her life changed with having the vaccine?
It's changed a lot. While she has autism, she's kind of that social part of the spectrum. And so while our family kind of was driven out of fear as the pandemic hit, losses were incurred, we kind of kept her in a bubble. She was homeschooled from August to January. We were lucky to have a special ed expert come and help her academically. But in January, we saw this mental health kind of condition, this isolation, this depression of we love each other. We are that family, but it only goes so far. From months and months, August to January, she needed to be at school. And they need to learn from each other and not have the fear that maybe our family had in the beginning of the pandemic. So she's able to be herself and be that social butterfly and create joy wherever she goes, because that's just her. And now that she has the vaccine, she's riding the bus, she's wearing her mask because that isn't an issue for her. I know it is for others. And she's able to just be a normal 12-year-old going to school and doing what we want for her.
I know you had mentioned maybe about mental health, if you wanted to talk a little bit about that.
Sure. Well, for our child, we saw signs. Everyone, knows their kid, and she just became more depressed. This kid is like Miss Sunshine. They all are. Even if you're not her parent, people go, "Oh my gosh, is this her every day?" And so we really saw that when she's so extreme one way, and then you see her going another way, it just broke our heart. It was a sign that we needed to take another direction. As a professional, I'm a PR and media relations specialist and had a client in the medical and behavioral health arena. And we just see a lot of mental health issues from having the opportunity to work with hundreds of experts. Isolation, domestic violence, when the abusee is actually forced to live with their abuser, depression, suicide, those kinds of things. We were lucky that we didn't have that impact. So I think for all of us, with or without a disability, just in our world, that mental health is a huge issue. And as mentioned, it is in different community groups of people, the Black community, the Latinx, the Asian. It's just a different delivery model sometimes. And inequity to a lot of those people in those communities. But for our child, we just noticed that she wasn't as sunny as she could possibly be. But I know that there's a lot of impact on all of us. I'm sure we could all agree that.
Thanks. And Lisa, I don't know, did you experience anything similar with mental health?
I would definitely say we saw a lot of differences in Ben. Certainly more connected to electronics, so wasn't as talkative as he has been, more difficult to engage in conversations. And yet on the other side, when we did get out in public and we were given those opportunities to interact with other people, he was incredible. He was funny. He was so craving that interaction that it was fantastic to watch it. So it was a definite need for him to be vaccinated, to be safe while in the community. He just shines. I think sunshine is an exact way to put it. He needs other people. We know that. It's part of his disorder.
Mm-hmm. Thanks. Lisa, if a parent is, considering getting the vaccine for their child, I mean, what advice would you offer?
So it's a big decision, I think. I think what they need to do is first contact your child's primary care physician and have that discussion. Do they have any underlying conditions that would make it difficult for them to have the vaccine, or are the side effects outweighing the benefits? And I think you have to look at that. And the only way to do that is to do your research, look into it, and then have those true conversations with your primary care physician, who should know the most about your child's medical conditions.
Thank you. And Joanne, what advice would you give to parents who are thinking about getting the vaccine for their child?
Much like what Lisa mentioned, I think, doing your due diligence, and I think I mentioned media earlier. I think people need to turn the TV off and just step away and really be with yourself. Your child. Hopefully you have a great relationship with your pediatrician and all the specialists that might be working with your individual. It's a personal opinion, and there's lots of decisions out there, and it impacts families differently. So I think you just have to do your due diligence, and I think you know in your heart what's best for your individual, because maybe it isn't the best, but for our family it was, because it gives them the ability to just live life like we're supposed to, without that fear and the virus taking over their lives. So I would just say you have to weigh out the pros and cons, knowing your child, because all of our kids are so different and have different abilities, and there could be someone that has an immune compromised situation that might look at it differently than how we did.
Thanks. One other question. What are some of the barriers that people with disabilities might face in getting the vaccine? Joanne, if you want to start.
Sure. Sorry, I would be happy to. So the barriers I feel impacts the community of people that we serve would be a couple things: transportation, whether that's the individual wanting to go to a CVS or a clinic to get their vaccine. It could be for a younger child with a disability that doesn't drive, that maybe mom and dad are working and aren't able to get there during those hours, or a single parent situation. So for me, that seems like that would be a barrier. And just having that access to the healthcare. And I know actually, Peggy, I think you had mentioned, guardianship. That is another really great, not great, but it's something to take into consideration, because in some cases, an individual might have a guardian that maybe differs in their view about the vaccine. So that could be a barrier as well.
Thanks. And Lisa, what are your thoughts on some of the barriers that people with disabilities are facing?
So I definitely completely agree with Joanne. The ones she listed are fantastic. The other ones that I would think of would be like lack of accurate information, or the lack of information in their native language to help them understand it. Are they getting access to information that will help them make a good decision for their child? Do they have a primary care physician that they have a relationship with, that they can actually have those conversations with? A lot of what Joanne had said, some of the rural areas, maybe the relationships and that trust isn't necessarily something that's as easily established as we are here in the city, where it's easy to get to your primary care physician, either by bus or car or whatnot. I think those would be the biggest ones that I can think of.
All right. Well, thank you. And, actually, that's a great place to end, because I think we are out of time, but I really want to thank you for both of you for coming and sharing your valuable experiences that you have. So thank you. And Matt, we'll turn it back to you.
Thank you.
Thank you. And yes, Peggy, Lisa and Joanne, thank you so much for sharing your experience and just the thought process, that went into your decision making. I think that will be very valuable to people viewing today and viewing the archive. And now I would like to introduce Dr. Mary Ciccarelli. We'd like to welcome her. We're very honored to have her today. As Jay Chuli mentioned, she is a professor of clinical medicine and clinical pediatrics at the IU, Indiana University School of Medicine, and she's the director of the Center for Youth and Adults with Conditions of Childhood. Dr. Ciccarelli?
Hi, everyone. Thanks so much for inviting me to come today. I'm going to try to share my screens. Let's see if I can do that safely. Hopefully you can see my screen now. Somebody just tell me yes.
Yes, you just need to put it in presentation mode.
Yep. So
Looks
I'm just going to start very simply with nearly everyone age 5 and older should get a COVID-19 vaccine as soon as possible. We have all been isolated and are suffering the consequences of having felt isolated for an extended period of time. And our best way out of that is to vaccinate our population. What do I know about the COVID vaccine? I know that they're safe. I know that they definitively save lives. And I know that getting your COVID shot is likely to help both you and the people you love. I think you might be interested in seeing this website called Theology, and the link is there because it does a nice job of describing how vaccines actually work. And primarily, vaccines work by your body receiving some information that it then uses to prep in case you have to face the real virus itself in the future. Vaccines are a piece of a virus, not the whole virus. They can't give you the infection itself because it's just a piece of the virus that gets injected into you. And then your body reacts to it and uses a number of different parts of your immune system to create a reaction. And so first the macrophages chew up the virus particles, the bits that are in the vaccine, and then it presents some particles to your other lymphocyte cells that are called T cells and B cells. And they actually together produce something called antibodies. And we measure antibodies in bloodstreams. You might have had antibody tests of various types in the past. And what an antibody does is hang around in your body to then react if your body gets challenged by the actual virus. And so the antibodies attack the virus and destroy it so that in fact it can't make you get the infection. And there are other cells that are called the memory cells, and those are ones that hang around for a little bit longer to come back and produce antibodies in the future if you need them. So that's just a very basic introduction to vaccines. You all probably have seen the news that children 5 to 11 can now be vaccinated. I wanted to talk a little bit about how the vaccine is different in this population. It comes in an orange bottle as compared to the purple one. And it is a dose that is about 1/3 the dose of teens and adults. And the reason the dose is different is because younger people are smaller, but more importantly, at different ages in life, our body's immune system is charged up or functions differently. And younger children actually have very active and vigorous immune systems typically, and therefore they don't need as much of the virus to produce a good vaccine response. And so the trials that went on in children with over 2,200 children looked at actually different doses compared against placebo, people who didn't get the actual vaccine at all, and showed that the 10 microgram dose is good for children in this age range, regardless of whether they're small 5-year-olds or large 11-year-olds. that dose works in this population. And it's more about their body's ability to fight immune systems rather than it is about their physical size and weight. And the studies have shown very good responses, somewhere between 80 and 90% efficacy in actually preventing serious illness in people who've gotten the vaccine and then been challenged by the virus. There are still side effects, even from this smaller dose, and fever and chills are the most common. And we're going to talk about those in another slide, but we're actually seeing in the trial population, there was slightly less fever and chills in the 5 to 11-year-olds than there were in the older population. It's been shown that you can get your flu shot or other vaccines at the same time as your COVID vaccine or within a 14-day period. It is recommended that everyone who gets the vaccine still is monitored for 15 minutes after the vaccination at a vaccine site. If you have particular history of immediate reactions to other vaccines, then it's recommended that you actually wait a little longer, more 30 minutes after getting the vaccine. I just wanted to show you a little bit more about the study. The studies are ongoing for 2 to 4-year-olds and 6 month to 24-month-olds. I don't know when those studies will come to review by the CDC. And people were randomized, as I already mentioned to you, and the safety and how it was tolerated and what reactions people had and how it's comparing against the 16 to 25-year-old population's response are all being collected. I'm going to talk a little bit more about how subsequent reactions are also being monitored. What about people with disabilities specifically? Well, we have seen that there is a higher risk from the COVID infection in certain subpopulations. And in general, in persons with disabilities, this has been found to be true. Particular people with limited mobility, people who have trouble understanding information and practicing hygiene issues like mask wearing and hand washing and social distancing, and in particular in people who might not be good at expressing their illness or pain to others. This population, we know, does have more chronic health conditions. Sometimes they live in group communal settings, and they may face some of the barriers we already talked about today in getting healthcare. And for all of those reasons, vaccination should be encouraged at a higher rate if possible in this population. Although I already told you, I want you all to get vaccinated. So who should not get a COVID vaccine? It's a very limited group are recommended to not receive it. So if you've previously had a severe allergic reaction or something we would call anaphylaxis from a messenger RNA vaccine, then you in fact have a contraindication to getting this vaccine. A severe allergic reaction is a rapid heartbeat, difficulty breathing, swelling in the throat, generalized hives all over the body, often needs to be treated with epinephrine or an EpiPen or treated with a visit to the hospital. The second group who are considered at risk in terms of getting a COVID vaccine are people who have had significant immediate allergic reactions to polysorbate or polyethylene glycol. And this is defined as having a reaction within 4 hours of getting vaccinated with hives, swelling, or wheezing. Many times people who have had this type of reaction have needed to have antihistamine to treat it. If you've had any of these situations in response to a vaccine or these products, you should talk to your doctor about what your risk is, versus what your benefit is. What are the typical side effects from these vaccines? Well, it is important to say out loud that these side effects are not infections. You can't get COVID from a COVID shot. I hope I can't say that any more clearly. The reason your body reacts when you get a vaccination is because it is mounting an immune response and it releases chemicals in response to that cause these symptoms. So you get pain, redness, and swelling in your arm, and that's the most common phenomenon. And some people have gotten red, itchy, swollen arms, and some people have called that COVID arm. And oops, I'm sorry. And I'm trying to move my camera around so I can see all the print. And this usually starts a few days to up to a week after the shot, and it can be quite large. And it is a reaction to the antigen. If you've had this, it is not a contraindication to getting the second shot or a booster. It is something that you might just consider use the other on the next time rather than that same one. There are some secondary other reactions to people who've gotten the vaccine, including feeling fatigue and headaches, muscle aches, some fever and chills, and even nausea. These typically occur in the first to second day after the vaccination and typically resolve by 48 hours afterwards. I just wanted to share that I got my vaccines in December and January. I did have some pain in my arm for about 2 days. I did enroll in the program called vSafe after being vaccinated. The importance of this vSafe health checker is that it is the way we are monitoring what's happening as we distribute the vaccine to the whole population. And it is particularly important for me to encourage all of you to enroll in vSafe after you've gotten vaccinated so you can monitor any reactions you have and we can collect that information as a country or as a world for that matter. I wanted to talk just a little bit about the talk about cardiac effects from the vaccine. There have been a total to date, as of last week, of 9 reported cases in about 9 million vaccinated youth of myocarditis. The CDC has completed thorough investigations of those cases in 3 cases so far, and they're in progress in the other 6. And it was noted that in those 3, the reaction was clearly not due to the vaccine, but the person had a secondary infection with the bacteria unrelated to the vaccine that was actually causing them myocarditis. In fact, one of them, I think, was a virus versus others bacteria. Myocarditis is an inflammation of the heart muscle. You are not at higher risk of getting myocarditis if you had some pre-existing heart condition. More information will be forthcoming on the evaluation of those other 6 cases. They're just not out yet. Most of these cases, not the 3 who were from bacteria and virus, but the others had mild symptoms that went away on their own. Symptoms you would watch for after a vaccination would be shortness of breath, chest pain, or feeling like your heart was pounding. So let's think about what are the possible risks and benefit. How do we weigh these as we think about COVID? We know that the frequency of significant risks is very rare. I'm not calling it a risk to get a sore arm. I'm calling a sore arm a good reaction to a vaccine. We know that the benefits are really high. We know that in this latest surge, the patients who've been in the hospital seriously ill have been, a vast majority of them are unvaccinated individuals. And in those who are vaccinated who have gotten the disease, they've had very reduced disease. Some of the people who have been sicker despite vaccination have been people who are immunocompromised or not able to mount an appropriate immune response because of other conditions that they have. I want everybody to know that messenger RNA vaccines aren't a brand new entity. This vaccine for this virus is new, but we've used messenger RNA as a technology for a long time. There's been, the testing started a month into the pandemic, so now 1.5 years ago. We had over 30,000 people volunteer within a few months to trial the vaccines. The CDC has used its rigorous methods of monitoring and assessing to demonstrate safety. The things we don't know. So the things we do know is that this vaccine works, and those that don't get the vaccine are at higher risk. And there are things we still need to learn about the disease that is COVID and about the reaction to the COVID vaccine. And that's why vSafe is so important, as well as continuing to watch how long people's immunity is staying once they've been vaccinated, and what happens when different variants come into the population. Of note, the vaccine is performing very well compared against the Delta variant, which is the variant we have predominantly or almost exclusively in our community right now. I thought I would just show you a slide that compares in children how often people need to be hospitalized with different diseases in a year, and how many deaths we see from that. So you have an order of magnitude, because many of you have chosen to vaccinate against hepatitis A or rotavirus or virus or chickenpox or even flu. And I want to show you that the hospitalization rates for COVID are in the same range as they are for influenza or flu, and higher than they are for chickenpox or hepatitis, but not as high as we see for rotavirus. However, the deaths are higher per year for COVID than for any of these other vaccines related illnesses that we now vaccinate for. So I wanted to help you with thinking about, how do I weigh between these different things? How does COVID behave in a comparator? So it's just a demonstration of how significant the pandemic actually is. I wanted to help you all to think about, how do I think about, if I am vaccinated versus I am not vaccinated, how I should behave out in community at this point. This is last week's picture of how the various counties in Indiana are performing in terms of their risk of catching COVID if you live or work in these communities. And red is high risk, and orange is moderate, and yellow is lower, not zero. And so we've just gone from being very red not just a month ago to now starting to cool off a little bit in terms of the frequency of diseases that are being reported around the state. I recommend, whether you are vaccinated, well, no, let's talk about the two different communities. I recommend that people who are unvaccinated get vaccinated, wear masks all the time, stay away from people, change their behaviors related to trying to avoid COVID. I recommend for people who are vaccinated for you to still consider that you're not at zero risk. You can have breakthrough disease, albeit lesser disease, after being vaccinated. And so I think you have to measure your choices based on risks and benefits. The CDC recommends, if you live in a high risk county, those red counties you see, you should still be wearing a mask, even if you're vaccinated when you're out in community. The recommendations soften a little as you become orange or yellow as a community. And so I think that wearing masks, if not prohibitive to you in any way, is still a good idea. And I wear a mask when I go to the grocery store and when I do other activities that allow me to wear a mask. When I'm around people whose vaccination status or illness status I don't know. I wanted to show you a little bit about why do we care so much about children? Well, children, the rate of infection in children since this school year started has increased 240% nationally. And the cases of deaths are still small, thank goodness, but it is not predictable which child is at risk to have a higher reaction or a lower. It is very unpredictable. And while the total numbers of deaths in children have been small, the periodic illness requiring hospitalization has still been notable. Our children's hospital has had lots of children with COVID admitted. There were some questions about who should get booster shots and when. I'm going to talk about underlying conditions and if you've had the infection. This is the current CDC list of who is considered a person with an underlying condition who might need to get a booster shot at this time. You'll notice pregnant women, especially on this list. We've learned certainly in the last month or so the increased risk during pregnancy of COVID and the safety of using the vaccine. You'll see chronic kidney disease and lung disease and diabetes, and specifically see Down syndrome, immunocompromised states, even being overweight or obese as an underlying condition that would merit receipt of a booster. The list is longer than that, and I haven't read everything on it, but you can see that list or review the slides afterwards. So I want you to do if you've had the infection. Having the infection does give you some protection. We are seeing more evidence that the vaccine is better protection than the infection itself, and probably lasts for a longer time. Although the length of time that the protection lasts is still an unknown, we think that people who are older, lose their protection from the shot sooner than people who are younger at this point. But more information needs to come in for us to really know that. So if you have an infection, if you have COVID right now, you should wait your 10-day period of infectiousness before getting vaccinated. If you were treated with something called a monoclonal antibody, that might block your response to a vaccine. In that circumstance, it is reasonable to wait 3 months before getting vaccinated. So should you believe the CDC and the World Health Organization's information that they put out related to COVID and your behaviors during COVID? I would say with as big capital letters as I could fit on the slide, yes, please do. Should you believe every news show or every person's blog who you don't even know on the internet and the advice they give about COVID? I would ask you not to do that. Should you trust your family and friends? Yes, but let me add the codicil. There are some exceptions to this. You need to know where they also got their information before you decide if they're likely to be giving you valid information. And how do you decide if you trust a doctor? Here's my plea for people to have primary care doctors. By having a primary care doctor and meeting with them regularly, you're likely to build a relationship over time and therefore know that this is a person whose advice I can trust and therefore I can use. And if I'm your primary care doctor, I'm going to tell you all the things I just told you, which is please get a COVID vaccine. I believe it will protect you. And I believe there are very few people who should not get it. The exception solely being people who've had significant allergic reactions to these types of vaccines in the past. What are we still learning? How well the vaccines protect people who have weaker immune systems. We don't have all the answers on that yet. How long is the protection going to last in each one of us? We don't have all the answers on that yet. We have some ideas about who really needs boosters, but we're still learning that. We don't really know exactly what percentage of the population needs to be vaccinated before we can all feel safe. You've heard the term herd immunity or population immunity about that. And then how well the vaccine might work against new variants that we haven't met yet. We know it's working pretty well against Delta, but what will happen if new variants come down the pike? We're just going to have to learn that as we go. What if it's hard for you to get a shot? How do you deal with your family member who really is afraid? Well, I think that there's a number of toolkits out there. The Autism Speaks Network has a lovely toolkit on blood drawing, and the information on how to help someone who's afraid of blood drawing is very similar to what I would use for someone who's afraid of shots. It's a real thing to be afraid. There are ways to help desensitize a person by practicing and talking through it. It's important to work collaboratively with your healthcare team to work on how you're going to approach actually doing the shot so that the person feels secure. Go with someone you love and trust. Let the person who's less scared go first and show the other person how it works. Use other things to distract the person from their fear. Put the person in a position that helps them to relax their muscles and relax their body, maybe by hugging someone. Or holding hands, all safety things to help comfort the person. I recommend avoiding excessive restraints and chasing people to do shots because it really promotes future fear. There are some people who practice using some kinds of skin numbing medicines, and this may work for some people, but it really just numbs the surface and not below. So it is not necessarily, there's not such a thing as completely pain-free shots. And then thinking about what kind of motivators or rewards might help somebody to be thinking forward about the reward rather than focusing so much on the shot. I think I tried to answer most of the questions on our question list. So Matt, I'm going to look to you if there are more things we want to talk about.
Thank you, Dr. Ciccarelli. Very informative. I will go ahead and ask a question that was submitted here just because this person obviously would like to have an answer to this. My daughter is 7, has Down syndrome, and has a history of not responding to the vaccine. Her physicians are recommending that we get vaccinated, but no one can answer if there's a way to check that she has responded with an appropriate protective response. Is there a blood test to check this?
There is an antibody test for a reaction to COVID. We don't know the answer to your question yet. So we don't know what titer of COVID antibody is meaningful in terms of its protection. We certainly don't know what it means in relationship to variants as they come into our communities. And so currently there aren't recommendations of knowing, is my child really protected from their vaccine? I think that the best advice we could likely give is that you should practice more social distancing techniques in an individual who may have a weakened immune system and therefore you have concerns about their protectivity from the vaccination. But that's the best we have now. It's again, one of those things we're still learning as the scientists of the country are collecting the data and monitoring it.
Great. And then I had a couple of questions that probably maybe I could just combine them. A couple of parents of children with Down syndrome concerned about the safety guidelines and vaccines for children specifically with Down syndrome. Did you have anything to say about that?
Down syndrome children are in the high risk group who are recommended to be vaccinated. That is the current recommendation. There is not any recommendations that they have risks from the vaccination any different from any other children. We've seen no evidence to that end. So they are high risk for the disease, therefore should be in the priority line to get vaccinated.
Great. And we had two questions that I'm going to kind of combine here because it seems like they're asking similar. They're concerned about, my 11-year-old is the size of a small adult, or would the dosage be appropriate for someone who's smaller than the average 5-year-old or larger than the average 11-year-old? They're asking.
So as I tried to answer already, the vaccine is based on age and immune ability, not by size. And so it does not matter if you are a small 5-year-old or a large 11-year-old, you should get the 5 to 11-year-old shot. If you are a small or large 12-year-old versus a small or large 50-year-old, you should get the adult shot.
And then, this might be, will the shots be given at pediatrician offices, pharmacies, or health departments? I guess specifically talking about
what I've read, and I don't know the answer yet, as this becomes, as we're in a rapid state of change right now, since they just started shipping the pediatric variant last week or end of last week, I think. They are targeting pediatric offices and federally qualified health centers as a higher priority, is what the CDC has said right when they made their announcements. I assume we're going to have them many other places as well. And I recommend the state website for looking for where vaccines are available. And I don't believe everybody's received their shipments yet or engaged that process yet at all the sites that are feasibly going to be open in the next week or so. So I would say stay tuned to the Indiana Department of Health website to help you with that.
Great. And then one last question. Some reports state that children will not require 2 shots as adults do nowadays. Is 1 shot sufficient protection against COVID?
It is the current recommendation with the Pfizer that children will get 2. Whether other vaccines have different recommendations, be that Moderna or Johnson & Johnson, et cetera, I think that data is as yet unproven. I can't project for you if we will find out over time that 1 will be enough for a child, but we won't have that information soon. It will take amassing a lot of information to get to those answers.
Great. Thank you again, Dr. Ciccarelli. One last thought for our participants today?
Please get vaccinated.
Thanks again. And for our closing announcements, I just would once again like to thank Dr. Ciccarelli for taking time away from our busy schedule to join us today. I'd like to thank our panelists, Joanne and Lisa, again for joining us and sharing their experience. And as you exit today, you will be presented with a survey. I would really encourage you to fill it out and give us your feedback. Certainly, we have a couple of more webinars we would like to do, and we would like to hear from you give us any feedback or any suggestions, topics to cover. At the end of our webinar today, we'll have a slide up that will have the information about how you can connect with the Center for Health Equity if you would like to participate in some of the activities we're doing here in the state of Indiana and the wider region to talk about COVID-19 vaccination for people with disabilities. We would really like to hear from you. And yes, we have that up now. So feel free to take a snapshot of that, or you can also contact us. We will be sending out an email here sometime after the webinar to remind people to fill out the survey, and you're welcome to contact us that way as well. And so I would like to end today's webinar and thank our sign language interpreter and our captioning for making this a better experience for everyone. And we'll be ending here. Thanks again for joining us today.